Hi, it's Dr. Alasio from Intentional Self Aesthetics, and today we're going to talk a little bit about plasma. So what exactly is plasma when we talk about aesthetics treatments? Plasma is the fourth state of matter. So we're not talking here about platelet-rich plasma or PRP. That's another topic, and that's another substance altogether, and I'll address that in a different video. But what here we're talking about is the fourth state of matter, plasma. So we have solid, liquid, gas, and plasma. Those are all the states of matter. And plasma, in these terms, we use plasma in aesthetics for skin tightening, for collagen recruitment, biorejuvenation, all the kinds of things that make our skin younger and smoother and brighter and lighter and tighter. So what kinds of treatments do we have with plasma? Well, the two treatments that I do in my practice are PlaDuo, which is this device here, and Plexr, which is a smaller device, almost like a pen, very handheld piece. So how are PlaDuo and Plexr different? Well, PlaDuo here uses a dual technology. It uses argon and nitrogen gas, and there are two different techniques that are used, and it usually addresses the full face or body areas to treat larger surfaces, and we're doing more like anti-inflammatory treatments all over the face, the neck, the back, the body. We're doing treatments of resurfacing and the like. With the Plexr, we're using a more precision device. It's more focused areas. We use this around the eyes to do blepharoplasties. We do it around the mouth to clean up the barcode areas. We do very focused treatments of the neck, of wrinkles, and these kinds of areas. And so this is for lifting and tightening and resurfacing smaller areas. So what can plasma help with? Plasma helps with, like as I mentioned, we can do it upper and lower blepharoplasties. The Plexr device is FDA approved for skin removal. We can actually remove tissue with the Plexr device. So we can remove the skin laxity, the extra skin of the upper eyes, so all that redundant skin that's produces the hooding and that upper eyelid droopy look. We can take that off. We can remove and resurface the barcode around the mouth that was formerly known as smoker's lines. We can resurface acne scars. We can take care of stretch marks. We can take care of fine lines and wrinkles. In the case of the PlaDuo, we can address anti-inflammatory treatments. You can address crepey skin, stretch marks, and other things such as removal of skin tags, xanthelasmas, and do overall skin tightening and resurfacing with plasma. So is it painful? Well, we usually for these types of treatments, we only require topical anesthesia. I use a combination of lidocaine and tetracaine in a plasticized base. So that means that this topical anesthesia will penetrate better, and it doesn't drip all over your face. So it actually sticks pretty well, and that usually provides the appropriate amount of anesthesia so that we can have the procedure. And you only have to numb for about 30 to 45 minutes before we can do the procedure. Another question I get a lot is there downtime? So with the PlaDuo, you usually have little to no downtime. This is not like laser treatments where you have several days of downtime. The PlaDuo, if you get an argon or nitrogen treatment or a combined argon nitrogen treatment, you're probably not looking at a lot of downtime, not more than like a day or two. However, with a Plexr, if you have an upper blepharoplasty, meaning if you have your eyelids worked on, you're probably looking at least a week where you have some swelling and you cannot wear makeup. It doesn't mean you can't go out. You just need to really take care of that area in a proper way. You can't go out in the sun or expose it to any sun or any harsh conditions. And you want to really baby your skin for a certain amount of time. How long do these treatments last? Usually these treatments last a good amount of time. With proper care and maintenance, these treatments can last anywhere from 1 to 3 years. So this is really well worth the investment. This is not like neuromodulators or even fillers. This lasts a good long time, and I would say it is well worth the investment. People also ask, how many sessions do you need of these treatments? Usually it's between 1 and 3. Usually you see results after one session. However, sometimes we repeat a treatment, we tweak it a little bit, but you have to do that several weeks after the first treatment so that you can really see and make an assessment as to what you want to tweak. Can these treatments be combined with other treatments? And that answer is absolutely yes. I often combine these treatments with RF microneedling, with BBL. I almost always use exosomes. Those go with everything. They're amazing treatments in and of themselves, but all of them put together, if you're doing a PlaDuo and then you do a Scarlet, that's, and then you throw exosomes on top of that, it's an amazing combination and your skin will look just incredible. Is it safe for all skin types? Well, the PlaDuo is, yes, it's definitely safe for all skin types, Fitzpatrick's 1 through 6. The Plexr is usually safe more so for lighter skin types, but we have used it on Fitzpatrick's 1 through 6. You can use it on the darker skin types, you just have to be a little more careful with the energy, but you can use it. So if you want to find out if you're a candidate for a plasma treatment, just get a consult to see if you are. So give us a call at Intentional Self Aesthetics and get in touch with us either online or call us up on the phone or visit our website, fill out a treatment planner, and figure out if you are a candidate for a plasma treatment with us. And I look forward to hearing from you.